I love Dr. Mark Hyman, the author of Young Forever and Chief Medical Officer at Function Health. I hate the scary data coming out about young people and serious illnesses, including cancers. Princess Kate opened our eyes, but the data should do even more. Doc, how do we get past the idea of correlation versus causation on this? Because you know my concern as someone with long COVID, so much of this spike is after the pandemic. I get obesity, but we were obese before. We had obesity before. The only thing that changed is the pandemic. Where's your head on this?
I mean, listen, I don't know if the data is strong enough to draw a direct causal link between COVID and cancer. But what I do know is that since 1990, there's been a 79% increase in cancers across the world in those under 50. It's the fastest growing segment of cancer in the population, and it's killing young people. And we don't really have a good way of dealing with it in our traditional healthcare system. And the good news is that with new scientific advances, liquid biopsies, essentially 2 bottles of blood that you can draw at a lab, can tell you whether or not you're at risk for over 50 cancers with a false positive rate of less than 0.5%. And that's really a massive medical breakthrough. But unfortunately, you're not getting it at your traditional healthcare system. And I co-founded a company to allow people access to their own lab data. It's a health platform called Function Health, and you can get this test. It's called Gallery Test by Grail. And it looks at over 50 different cancers, and it's very effective in detecting early phase 1 cancers. And we've seen a number of cancers in our population, which has been quite surprising in the young adults. So I think it's important for people to understand that we've seen increasing cancer rates, probably because of our ultra-processed food, the sugar diet, and also environmental toxins. And all those things are contributing to this increase in cancer rates among the young.
But why such a dramatic spike since 2019?
I think there's been a spike. I don't know how dramatic it's been. I think we see a slight increase, but it's really because probably the immune system plays a huge role in cancer, and inflammation is connected to cancer. So hypothetically, if the COVID disease created persistent inflammation in the body, which it has for many people with long COVID, it drives inflammation, which then can drive cancer. So that may be the mechanism, and I think we need more data to determine what the causal mechanism is, but there certainly is a concern of this increased inflammatory state, and we're seeing this on our tests with Function Health. We're seeing people 46% have high levels of CRP, which is an inflammatory marker. 30% have autoimmune markers. We're seeing all sorts of things that we didn't see before. So I agree with you, Chris. There is something cooking in the soup.
Well, thank God for Dr. Hyman and Function Health, so you can get some testing and see your own risk profile no matter what your age is. But we got to get more answers from the people who are using our tax dollars supposedly to do the research. Dr. Mark Hyman, thank you. I love having you on the show. It's great to see you again. Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find News Nation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of News Nation's fact-driven coverage.